In athletic rehabilitation after an injury, we can restore an athlete to what we may call normal. And in terms of normal, we mean normal range of motion, normal strength, or even normal running. But in athletes, that normal doesn't mean they're ready to go back to sport. They still have a lot to do in order to move from that normal baseline to really returning to the field as an athlete. They still need to restore their power, speed, and agility to get back to that sport both safely and effectively. And sometimes that can be a challenge. For example, if an athlete is receiving physical therapy in a clinic and the insurance company is covering the bill, most of the time, that insurance will only pay for what it takes to get that person back to normal. But remember, for an athlete, normal isn't normal. That we need to do a little bit more for the athlete after rehabilitation. We can't just throw them back on the field and expect them to perform at the level that they were before they got hurt. They may need to be doing more advanced exercises, things like plyometrics or interval training, speed training, agility drills, or particularly sport specific skills, which has really left a gap, if you will, between the rehabilitation and the performance. And that gap is not just a period of time between rehab and return to sport. It's also a knowledge gap, or at least it used to be a wider gap until our next guest really built that bridge between rehab and performance. Sometimes called the queen of bridging the gap, Sue Falsone is a longtime friend of mine, as well as a physical therapist and athletic trainer, and even author of a book called Bridging the Gap from Rehab to Performance. She's also the owner of an educational company, Structure and Function, and travels around the world to give educational seminars on dry needling and continues to treat professional athletes of numerous sports from rehab to performance. Her stops along the way include Athletes Performance, which is now Exos. She was the head trainer for the LA Dodgers baseball team and the U.S. soccer team, and she teaches in the athletic training curriculum at A.T. Still University in Arizona. So thanks for joining us today, Sue, in your busy schedule.
Yeah, thanks for having me. It's wonderful to chat with you as usual, as a friend, as a colleague, as a mentor. So thanks for
A
having me.
mentor? No, I wouldn't go that far, but
Of course I
you've
would.
taught me so much, Sue. It's just from the day I met you, there's just something special about you, and I've admired your entire journey the entire way, and just so honored to be your friend and working with you in all these years. So, if you would just tell us a little bit about yourself. Take us how you got to be where you are today.
Yeah, I'll try to make that quick because that could be just an hour-long podcast in and of itself. Yeah, I mean, grew up in Buffalo, New York, went to Damon College for my physical therapy school. It was a bachelor's degree at the time. Moved down to North Carolina, got my first job, decided that I wanted to explore a little bit more of sports medicine. Went to the University of North Carolina at Chapel Hill to explore and study sports medicine, human movement with concentration in sports medicine. That's where I did my athletic training and began some personal training things, then got my CSCS. And so started to do personal training and strength and conditioning type things. Then when I moved out to Arizona and I met a man named Mark Verstegen who owned Athletes Performance, which is now called Exos. And volunteered my time for probably 6 months before I think he realized I wasn't going to go away and he had to give me a job. So, started working in that atmosphere. And so it was really at Athletes Performance that, for the first time, I saw that I wasn't going to have to pick the letters after my name that I wanted to be defined by. Every other job I was looking at was like, oh, here's a physical therapy job, or this is an athletic training job, or this is a strength and conditioning job. And, that opportunity with Mark that lasted for 13 years of my life really gave me the opportunity to not have to pick one of those professions and allowed me to blend all three and really set me up for the philosophy and the implementation of that philosophy to this day that I have, which, there isn't a time when rehab ends and performance begins. It's all one big long continuum. And how do we truly bridge that gap from rehab to performance, which oftentimes is the missing piece when people are trying to come back from an injury?
So you touched on it, but can you kind of define where that gap is, why it's important? What do we need to look for in terms of our athletic rehab, our performance health team?
Yeah, I'll never forget. There were two very specific incidences. One, the more I was watching sport, and I was hanging out with the strength coaches, the more I hang out with strength coaches, the better clinician I become. Like that's for sure a thing, and that's helped me in my rehab career.
Hmm.
And I just remember kind of being out on the field. Of course, we've all watched football. I grew up in Buffalo, Buffalo Bills fan, right? By law, you have to, watch Buffalo Bills every Sunday. And so, I've watched football, but it wasn't until I was like on the sideline with the strength coaches and kind of going through some very, very specific offensive lineman drills that I thought, oh no, my 3 sets of 10 of step ups does not prepare them for what they need to do after an ankle sprain or after a knee injury. And it was just such a huge aha moment. And I remember putting together, one of the guys that we were working with at the time had an ankle injury. And I brought, my plan, my program to one of the coaches that I was working with. His name was Daryl Leto, just wonderful, wonderful strength coach. And he looked at it and he kind of nodded. He was like, this is great. And I made a 3-week plan. 3-week plan. And Daryl looked at it. He's like, oh yeah, this is awesome. What are you going to do with him tomorrow? And I was like, what do you mean? That's a 3-week plan. He's like, he'll accomplish this by tomorrow. And I thought, oh, I'm just working with a totally different caliber athlete, right? And person coming from this rehabilitation model. And so,
Yeah.
it hang out with strength coaches. It's going to make you a better clinician.
No, I agree. I think having those different viewpoints is really important, and taking advantage of those opportunities is huge for students. Is
Yeah.
and you have to do that. I always tell students, you got to do these extra things. Getting involved with strength coaches, not just worrying about what's going to be on the test. It's really about taking advantage of these life opportunities. And it's hard for me, and I know it's hard for you to say no, but that's how I think you get ahead. And it does create a chaotic situation, as we both know every day. Now, when you developed this this gap, bridging the gap, you put together some kind of a system, I think you did, right, that helped kind of guide you through that gap. Tell us a little bit about that system, how it's based on going from pain to performance, and kind of why we need a system.
Yeah. I had been, once I started working at Athletes Performance, I'd been working on the quote unquote performance side of the house for so long. I really wasn't doing a lot of post-operative rehab or really acute rehab. It was sort of one of those things where I was working with a lot of people who were finished with their physical therapy program, but they weren't ready to return to the field. And so I was really, really working closely with the strength and conditioning team at Athletes Performance. And so had just been functioning in that space for so long. And so I kind of wanted to get back to my rehab roots. And so I started taking some classes through the International Academy of Orthopedic Medicine. And there I met a guy named Phil Sizer. And Phil Sizer is a PT professor at Texas Tech University. And he and I just totally hit it off because he was trying to get more into the performance. I was trying to come back to my rehab. And it was just like, we sort of were like, oh, we were so excited to meet each other. And Phil he's got such a great mind. And he really helped me to get my thoughts down on paper and helped me to sort of define this organizational system that talks about identifying the pain generator and how does the pain generator work within the kinetic chain, and how does what we call psychomotor control, like how does the mind body connection work, and then what's happening from a nervous system standpoint, and then a strength and power development standpoint, an athletic movement standpoint, and ultimately sport specific type thing. So really there's these 7 categories that I use to define the bridging the gap from rehab to performance process. And one block isn't bigger than the others. And it's really not a continuum, because we know that people can work on strength and power as well as kinetic chain issues at the same time. And so, and people are always playing sport, unfortunately, when they're in pain. So it's not this like specific continuum. It's really an organizational system that says all of these things are important. And how do we make sure we don't miss anything?
Mm-hmm. Yeah, so that's important. It's like a checklist where you have to make sure that you have checked the box. And sometimes you have to go back and recheck the box occasionally. But look what I have. I have my book, which I love, and I give to my sports medicine students here at the university. So you know that I read that from cover to cover. I've told you that. For as soon as I got it, I had to read it, loved it. And the thing I really liked about it was that it was designed for, I think, both ends of the gap, right? So you had your PTs, your athletic trainers over here, and you'd have your strength coaches and your athletes over here. And I enjoyed the strength coach athlete side of it. And I think that maybe the strength coach, it would kind of cross both ways, because you talk a lot about pain and the stuff that we learn in school, but you also talked about all the sports stuff that we didn't talk about in school. And even as an athletic trainer, like you said, this was the strength coach stuff. So the book is great. And how do you look at it, how it should be used by which audience, kind of in that context? What should the reader take away from that book or use that book?
That's a great question. And it actually was really difficult to write because I identify with those three, professions
Right.
so intimately that it's really difficult for me to sort of break those things into different parts. And so my editor, Larry Draper, who is just, she's just a brilliant, brilliant editor. We struggled with it because my voice changed at different parts in the book, right? And she was like, "You can totally hear the voice change when you go into strength and conditioning mode." And I'm like, I don't know how to fix it. But really, like, I think we did. I think with her help, we
Yeah.
got the voice kind of consistent, which was great. But for me, I really think very few people. I mean, I think you will, as a clinician, find value within the book in the beginning part. But really, I wrote the ending, the strength and conditioning part, for the clinician. And same
Mhm.
thing, like for the strength and conditioning person, yeah, I think you're probably going to pick up a couple pearls, but like I really wrote the rehabby part for the strength and conditioning coach.
Right.
So I really wrote it opposite from what people probably think in mind. The beginning of the book, the more rehabby book, I geared to educate the strength and conditioning coach.
Right.
And the performance side of the book, I really geared towards the healthcare professional because I want everybody to be able to speak the same language. I
Right.
want everybody to be able to have some crossover, even if it's not in execution, but in philosophy. So everybody sort of understands, the philosophical application of this process.
Yeah, and the terminology, like you said, being on the same page is really important. That what we talk about between coaches and athletic trainers and physical therapists and strength and conditioning, we all need to be on the same page, talking the same language, and really rooted in all of the foundational knowledge that you brought. I love the eclectic side of it, from everything. I think you talk about fascial work in there. You've talked about all kinds of things, and breathing, and just very holistic approach that I think it benefits everybody. So I definitely recommend anyone to read that book. Now, moving on back to kind of your career. And so let's see, you said you started in athletic training, went to physical therapy school. No,
Opposite.
opposite. You
Yeah,
started
I
PT
said
school.
PT.
That's right. But anyway, you ended up being what we call dual credentialed. So you and I are both dual credentialed. And, back in those days, it was a little bit easier than it is now to attain that. Today, you really have to have a master's degree in athletic training and a doctorate in physical therapy. I would say that our knowledge back then was probably about the same. It's just how it's packaged now. So today we don't have as many dual credentialed. So, but when we're out seeking for that team member and talking particularly about professional sports, I know that there are a lot of dual credentialed individuals. Why is that important when we talk about athletes, or is it important to be dual credentialed? What do you want to see in individuals like that?
Yeah, I think, of course, I'm going to be on the side of the fence that thinks there's tons of value in having a dual credential because I am dual credentialed, and it was important to me to do so, and it is rare to go back to get your athletic training degree after your PT degree, which is the way I did it. But it was really important to me. I wanted to understand the athletic training, and I'm going to speak very generally because there's always the athletic trainer who has more experience in rehab, and there's always the physical therapist that has more experience on the acute side of the house. But very generally, I felt really, really comfortable after having a physician's script, a diagnosis, diagnostic tests.
Mhm.
We know exactly what's going on. Okay, now Sue, proceed with rehab. That was at the time very, very much my physical therapy education and experience. And so the athletic training part for me was very much emergency care, urgent care, acute care. We don't know what's going on. What's your differential diagnosis? What's life threatening? What's limb threatening? What is, can they continue to play? Can they not continue to play? And then sort of figuring out your differential diagnosis and then going from there. Where do I need to refer this person within the healthcare system in order to get proper
Mhm.
diagnostics and
Mhm.
workups to then get them into the right hands from a rehab perspective? So I just felt like the athletic training really provided me with that beginning aspect of healthcare for my client that I really had never had that experience before. And it's not intuitive. You need education in those things and how to safely remove someone from the field, or, making those quick, very quick decisions. Sometimes you've got 60 seconds or 2 minutes to make those decisions. And so, what are the things to look for? And so, yeah, that to me, those are really the differences in my education between the two, and they are just a simple natural blend for sure.
Yeah, I flip flop. That's why I got it wrong. I went to athletic training first, then physical therapy. The reason why I went to PT school was to be a better athletic trainer in rehabilitation.
Mhm.
I felt that rehabilitation was lacking in athletic training.
Mhm.
We spend so much time doing all those other things you talked about,
Mhm.
that I had to learn a little bit more about it. And the point I try to make with this is you don't just, I wouldn't really say that any physical therapist off the street without that extra training would really know about that gap and how to work that. They can get you that normal we talked about at the very beginning, but it's that gap that I really think that either a dual credential or you could be a sports certified specialist. I
Mhm.
think that's the way that people are overcoming this dual credential. The SCS specialization for the Board of Physical Therapy Specialties covers a lot of that. I think you have that certification as well.
I do.
Um, and so that's extra training that does give that individual what they would need. So when you're looking for, a physical therapist who's working with athletes, those are some things to look for. Either have dual credentialed, the SCS, or even have a CSCS, the Certified Strength and Conditioning Specialist as well. Okay, so back to what you're doing today. After all that, I know that you really condensed your experience. I know that you have done so much, and to see where you are now, your big thing now is teaching dry needling, right? So for those of you who don't really know what it is, and there's probably a lot of still questions and people don't really know what we're talking about, uh, can you kind of describe what dry needling is and how it fits in with athletic performance?
Yeah, dry needling is where we insert a fine filiform needle into the skin to stimulate a healing response. And so, from across the room, it's probably would look familiar to you if you've ever seen acupuncture done. From across the room, you're not going to know the difference. Oh, is someone doing acupuncture? Are they doing dry needling? So we use the same tool, but the placement of those needles, the philosophy behind where those needles are placed and why, and sort of the goal of the needles usage is very different in acupuncture that's rooted in traditional Chinese medicine versus dry needling, which is really rooted in Western medicine. And again, just like as an AT and PT, I'm kind of speaking very generally. There's plenty of dry needling people who practice more with a TCM mindset, and there's plenty of traditional Chinese medicine people who practice with more of a Western medical mindset. So, there is no Eastern physiology and Western physiology, there's just physiology. So, whether we're able to sort of quantify that physiology within Western medicine that makes more sense to us, that's always helpful. But yeah, it looks like acupuncture from across the room. For me, I use it very specifically with my clients in a variety of different ways, anything from pain management and pain control. I'm very big on getting my athletes off of their drugs. It is rampant to use pain medication and anti-inflammatories within sport performance. I mean, so many of the athletes are using things to just get through their practice, right, at the professional level. And so let me clarify that. I work at the professional level, not at the high school level. And so at the pro level, lots of people are using different things to kind of manage that, right? And then, or afterward too, like utilization of alcohol or drugs in order to kind of manage their long-term chronic pain once they're retired. So for me, needling is a wonderful way to help with pain management and pain control without the use of drugs, which is super important to me and my clientele. I use it a lot from a recovery and regeneration standpoint. So not just from a local recovery, like in muscle recovery, but in the autonomic nervous system recovery. We live, and my athletes and clients live so much in lights, camera, action, and 50,000 people screaming their name and just insanity always happening. And so for them they live in the sympathetic and tap into the parasympathetic in the 20 minutes that we work on meditation or yoga or needling, right? And it really should be the other way around. We all should be living in the parasympathetic and use the sympathetic as our fight or flight. But, now, especially over the last year and a half, we're all staring at computer screens all day. Our pupils are super dilated. I mean, that just keeps our sympathetic nervous system going. So I use needling a lot to tap into parasympathetic to help with my clients' recovery, regeneration. That helps with their digestion, their sleep, all of those sorts of things as well. And then sure, if someone's got some local scar tissue or muscle tightness, we can use needles as well for that. So needling for me, it's such a Swiss Army knife. It can be very prognostic. It can be very diagnostic, depending on how I use it and how I apply it. And I, like everything I do, me, I apply things in a very eclectic and holistic fashion. And so there's just a lot of really good benefits for needles. And, we were just talking before we started recording about my dog being diagnosed with valley fever, which is a fungal infection that animals and humans can get out here living in the desert and in Arizona. And so, I took for doggy acupuncture twice, and so I posted, the doggy acupuncture session. I didn't do it. I had the vet do it. But so needles, animals are such a great way to like figure out placebo effect versus, people want to argue like, oh, it's such a placebo. I'm like, really? Because all of a sudden my dog can walk today and he couldn't walk yesterday. So probably not a placebo. Just because you don't believe in it doesn't mean it doesn't work. But yeah, so I mean, I think there's just so many different benefits to needling and how it fits within the performance. But ultimately, it's about how do I make my client feel better? How do I make them move better? And needles get me to that ultimate goal. It's not about passive treatment. It's about how do they live better and move better.
So there's a lot of different approaches out there to dry needling in these certification courses and things like that. How is your system? Is it different than what another provider might have out there?
Yeah, I think everything I just said, I don't know any other provider that approaches needling, the way I do and the way we do it, structure and function. It's very, very holistic. And so, other people do a great job, but they, they definitely have specific uses for needles. And I think, I dare say we have probably the most eclectic and holistic approach to the utilization of needles for well-being, as opposed to just one specific way to use it.
So what do you think the future is then of dry needling? Where are we going with it?
That's a really good question. I think people are becoming more open. I like to think that's my, everybody hold hands and sing We Are the World philosophy. There is such a controversy between Eastern and Western medicine. And I've spent really the majority of my career trying to reconcile these two things, and I continue to do so in my general practice. And, I think that people are understanding as a whole the more holistic need and whole person need across the board, right? Whether it's needles or whether it's your physician or whether, right, it's not, more and more people are understanding, okay, I can't just go to the doctor and take a pill. I can't just go to therapy and lay on the table and have them rub an ultrasound unit on me. Like there are holistic things, and my nutrition is affecting why my shoulder hurts. My poor sleep patterns are affecting why my knee hurts, and why, different things. So I think people in general, whether it's because of social media and because of our interconnectedness, that people are being exposed to more things, that maybe that's why. But, all I know is my 78-year-old mom is like, hey, have you heard about, like, they shine a red light on you and it's like a laser? And I'm like, yeah, it's laser therapy, right? And so the fact that my mom is like asking me these things, I think is just a true testament to that people are becoming more open about maybe some things we don't fully understand, but might be able to help in holistic healthcare, which I think is a great thing.
Yeah, you've, like I said earlier, you've been very eclectic, and I think on both sides, from the technology side to that holistic side of bringing in nutrition, breathing, yoga, and something that's also, and what I've noticed, I think with a lot of these things, and you mentioned it earlier, placebo, believe in it or not, what really matters is that person getting better,
Mhm.
whether it's placebo or not. Okay, if it's not, for me, if it's not very expensive or harmful, and it's particularly in athletes, placebo is fine with me. um but in that vein, it gives you a lot of critics. And um one of what I just don't like, people using these huge claims and not recognizing this potential for a placebo effect. Now, that's how I am with that horse. But there's something else out there where patients and athletes that have been through the ringer, right? They've seen, and you've seen these athletes that have seen all kinds of people. And it's not until they see Sue Falsone, who's the miracle worker, because you do have the ability to use these other things, right? And I would tell people, it's not that you're crazy or that there's nothing wrong with you. It's that you haven't found the person that sees what's wrong with you and knows how to treat it. One of those things I think that comes to mind that you're really big into is the fascial manipulation. And I've heard of tremendous things of how beneficial that is. And just in the next few seconds here, I know you could talk forever on it, but that's one of those words that'll come up in athletes and things. What is it? How does it help? What should we be looking for athletes that might benefit from that?
Yeah, needles and fascial manipulation are a gigantic portion of my practice. So I use FM with needles. I use FM with my thumbs. I use their concepts daily in my practice. And so the specific term fascial manipulation is actually related to Luigi Stecco and Antonio and Carla Stecco, who are a group of MDs and physios out in Italy. And so that term is really coined by them, and a very, very specific approach to the evaluation of the fascial system. And so as we look at fascia, you can almost think that like these fascial, they teach you these fascial points. And you can argue that fascial points are a misnomer because fascia is everywhere. So there's no such thing as a fascial point, right? But the way I describe it to people is that it's about a keystone. And so if you think about architecture and you look at these arches that have been built for bazillions of thousands of years all over the world, a stone can fall out of an arch, right? Or you can pull a stone out of an arch unless you pull out the keystone. If you pull out the keystone of an arch, the entire thing falls down. And that's what these fascial points are. There's fascia everywhere throughout our body, but if you can find the keystone that lets the entire thing go, that's what we're looking for, because who has time to work on the entire body? So these things very much are very, very specific points. The fascial point is here. It's not here, it's here.
Mm-hmm.
And so, the interesting part of it all is that when we look at these points and we overlap them with the acupuncture points, there's like a 90% overlap with the acupuncture points.
Mm-hmm.
And so, when you look at the Chinese word, for meridian, and if anyone on here speaks Chinese, I am gonna butcher this, so I apologize, but it's called Jinglao. And Jinglao, when you look at the characters of Jinglao, and if you use any of those languages or know those languages, you know that the words are made up of characters, and the different characters together create different meanings. So one character might mean something in one word and then a different meaning in another word because of the other characters that it's with. And so when you look at the characters of Jing Lao, there's a character for silk, there is a character for web, for a character of underground, for network, right? And so when you start to put these things together of the meridian and you look at these individual characters, what's an underground web of silk?
Yeah.
Fascia, right? And so they were telling us from minute one to look at the fascia when it comes to acupuncture. And so for me, these things really overlap, which is why I've gotten so into the fascial manipulation stuff, because it's just a really cool way to reconcile the two.
I don't know what's next for you. You just keep going next on the next thing, the next thing. It's like, I want to follow you for the stock markets. It will tell you what's going to be hot next. All right. So take us, if you can, this is going to be a bad question. What's a typical, I usually say, what's a typical day look like for you? That isn't going to work for you. I would even say, what's a typical week look like for you with all the things you do? Because I know you're traveling everywhere, you're teaching.
This is a great week to say that. So like, I had a friend in town for the weekend. She flew out this morning. We're doing a webinar. I've got patients this afternoon. Tomorrow I'm flying to Vegas. So I work with one of the guys from the Raiders. I've worked with him on and off for 17 years. So fly to Vegas tomorrow. We'll work with him tomorrow afternoon, fly home tomorrow night. More patients here on Wednesday, in between managing and running our education business. Thursday, we teach our dissection class for structure and function education. So we've got our dissection course Thursday through the weekend. So I'll be in the dissection lab for the next 4 days, teaching students anatomy and needle safety with the cadavers and those sorts of things. So yeah, it's just, there's a lot of, and then like Wednesday, I'll have my business meetings and marketing meetings and social media meetings. And so, yeah, it's just everything from patient care to business meetings, and to traveling to see patients as well. So it's just, it's great. It's a crazy life, even post-COVID, but it's great.
Yeah, you've been that individual who probably racked up a lot more miles than I did in my career, from the fact that you actually travel to see patients. They come to you and you go to them, which is kind of cool, but it also obviously takes up a lot of time. So how do you take care of yourself with all the stuff going on?
Yeah, lots of meditation. I start and end almost every day with a 20 to 30-minute meditation before I even get out of bed or before I fall asleep.
Wow.
Yeah. And, before I even get out of bed, I just like spend some time in gratitude. And I just, there's days where you're just like, things are looking bad, right? We all have bad days and bleak days. And so, sometimes that gratitude session is like, okay, I have a safe space to live in, right? Which a lot of people don't. And I have food and I have my dog, right? And so sometimes your gratitude sessions are just fundamental needs and that you're grateful for. And other times it's all of these other things. And so, yeah, just trying to spend a lot of time in meditation or meditative prayer and gratitude and sort of those sorts of things. And then, I do work out daily, probably 5-6 days a week, at least 1 to 2 days a week of yoga. And really, as I'm getting older. So as you get older, workouts have a whole different meaning. And so like I was in Buffalo visiting my mom a couple weeks ago, and there's no workout equipment, and the house is kind of small and it's Buffalo, so the weather wasn't fantastic. And so I just spent 15 minutes literally getting up and off the ground. So I didn't use my hands. I didn't, I pretended like my right arm was broken. So get up off the ground with my 2 hands and my one arm and then my other arm. And then, so just making sure that like some of those fundamental things of, can I get up off the ground? Do I have the mobility to do so? Do I have the strength to do so? And just kind of making sure that my brain and soul and body are all sort of staying in this health wellness pathway, which I haven't always been that way. And so, yeah. And then sleep has been what I've really learned in the last year and a half is that I need way more sleep than I thought I needed. And sleep has just really become a
Yeah.
huge priority for me too.
I can imagine with your schedule, that's huge. For me, not just getting up off of the floor, but doing it quietly is important. Oh, that's what I'm working on. All right, let's wrap up now. So, you don't like it when people say you were the first female athletic trainer. I get that. I love it. I think you're exactly right. You were a head athletic trainer that serves as a role model for a lot of people in the profession. What you did in breaking barriers and just working hard, whether the fact is that you're female or not, to me wasn't as important as you worked really hard to get where you were, and you did a damn good job at it. But a lot of people look at it as you're a role model. And I've seen the comments that people have made for you, young female athletic trainers, and looking up to you for what you've done. And so you've done so much, you haven't stopped, you're still going, you've never rested on your laurels, you're still that role model for everyone today for your accomplishments. What can you leave our students with, of kind of, how do you get to be where you are today? And I have to tell you, I have to preface this by saying you don't get this way your first day out of school. So what is your advice for our students out there?
Yeah, I appreciate those kind words. That is very, very kind and very, very sweet. I think I think when I speak to students, they have sort of this unrealistic expectation based on them.
They do.
I don't know where it comes from because, anyone who I know is a professor is not placing these things on that. So I don't know where it comes from, but they're always like, well, I want to do what you do. And I want to be the head athletic trainer for the Dodgers. I'm like, okay, well, I did that 11 years after I graduated,
Right.
not 11 weeks
Right.
or 11 days. Right. And so, and that wasn't even my goal per se. It was
Right.
like, I didn't really know what I wanted to do. I knew more what I didn't want to do. And no offense to anyone who's doing it, that's fine. It's just for me, I didn't want to work in a clinic from 8 to 5, Monday through Friday.
Mhm.
I just knew I didn't want to do it. I had done it and I didn't love it. It wasn't as fulfilling to me as I thought it was going to be. And so I started to search out other paths for me and my career. And again, if that's what you want to do, that's awesome. Please. I mean, that's great. It just wasn't my path. And so I didn't know what I wanted to do, but I knew what I didn't want to do. And sometimes that is just as powerful, right? So when you're graduating and you're young and you've got that first, like your first job's not going to be your last job. And you're going to learn something from it that will then prepare you for the next step, right? And there's that saying, I know he didn't make it up, but the first time I heard it was from a guy named Al Vermeil, who was the strength and conditioning coach for the Chicago Bulls during their heyday. And he's the first person that I ever heard talk about luck is when preparedness meets opportunity. And that has become a very poignant thing in my life, is that of course I've been lucky in my career. I was prepared when an opportunity presented itself, right? And so I got prepared by working in a very, very busy outpatient orthopedic clinic, by working as a personal trainer, by working as a strength coach, and by, all of these steps along the way that prepared me for an opportunity when it presented myself. So I just feel like remove those unrealistic barriers of, if you're not the head athletic trainer of a Major League Baseball team by the time, you're 3 months out of school, like, I don't know where that comes from. It took me 11 years to get that job. So yeah, I would say just like take a breath, right? Like I have the word breathe tattooed on my finger for a reason. Take a breath, enjoy the path, and learn your lessons and continue to move on. Your path it'll fold out.
Yeah, I love the be prepared, be patient, breathe, a lot of breathing and yoga and sleep, and being prepared for that opportunity. One of the things, I mean, I just think about how I got to meet you. I was in the right place at the right time, and I didn't, I actually, Mark had introduced me to you. I was there to meet Mark, right?
Right. Right.
And he said, no, you need to talk to Sue. And I was like, wow, she blew me away. And ever since then, it's just been a love affair with you and everything that you've done. I'm so happy that you've taken the time to be with us, today, but also for the 20 something years that we've hung out. So looking forward to many more of those. Appreciate you taking the time and sharing all your wisdom, Dr. Falsone. Thank you so much.
Thank you so much.
All right. Well, have a great day. And students, listen to her. She knows what she's talking about.
Thank you.
All right. Take care, everyone. Bye bye.
Thank you.